And we are live. It's Dr. J here in the house with Evan Brand. We were talking in the pre-show. We are going to be chatting all about Candida and mood issues. Today's going to be a phenomenal chat. Evan, how are we doing today, man?
I'm doing really well. We were having some fun here, looking through some studies like we always do, and we found some interesting things which will challenge the conventional treatment options for Candida. Why don't we start right out of the gate here? We're going to get into the whole background of like what is Candida, what kind of mood issues, what contributes to Candida. We'll get into that, but let's just go straight to this because this kind of blew my mind, which is that fluconazole, which is a antifungal medication commonly prescribed to treat Candida. It was found in a study here that when you use this fluconazole, that it actually causes the Candida to basically go into, it's an asexual critter basically, and it reproduces by cell division. And when you get exposed to that fluconazole, the Candida goes, holy smokes, and then boom, it switches to sexual reproduction mode, therefore making your problem worse, which is why, what would you say, 1,000+ people have come to you and I, between us plus more than that, that have already done fluconazole and they still had Candida overgrowth. Well, there's your reason why.
100%. I think number one is you need like a really good working kind of model on how you address Candida or any infection. And it's not just we throw some herbs at it. It's number one, we starve it out with the right dietary changes, but we also have to make sure the food's not creating a stress, because healthy foods not digested appropriately are going to be hard on the body, even if they're really good paleo template kind of foods. Number two, we kill it, we wipe it out, but we have to get the body and the stress handling system and the immune system ready for that, because it can be stressful on the body. And then number three, we crowd it out, re-inoculate, repopulate it out. And as you go through that kind of three-step approach to killing various infections or Candida, one, it reduces inflammation. Two, it supports the immune system. And three, it helps gut barrier integrity. So we're not just kind of coming in there trying to target and, search and destroy, so to speak. There's a whole multifaceted approach with supporting the hormonal system, supporting digestion, addressing food allergens, improving immune barrier integrity, and then going after a lot of the critters on the backside. So it's really a multifactorial approach. Now, you highlighted one thing with the fluconazole and how it stimulates reproduction. Now, some would say about herbs. Well, what happens with herbs? Now, herbs are a little bit different than medications. Here's why. Medications will kill various microbes, right? Fluconazole will target more fungus. The difference is when you have, like, let's say oil of oregano, there's multiple active compounds in there. So in oil of oregano, you have carbachol, which is like the active compound in there. You also have thymol, right? Thymol is going to also help kill microbes. Now, the thymol also has a compound to it that helps support the immune system, and it protects against toxins. And there's also rosmarinic acid, which is a derivative of vitamin E, which is also going to protect against oxidative damage and the free radical stress of the microbes dying. So you have oxidative support, you have immune support. So there's a lot of other compounds that are thrown into the mix that are modulating and supporting the body in a different way than an antifungal may not by itself.
Very cool. Well, and I just want to point out what you just said, which is that there's an antioxidant potential for this, meaning when you go through a protocol, you don't have to feel worse. Many people think, and their practitioner has incorrectly educated them, that they must feel bad and you're going to have all this die off and that's the bugs and you just got to push through and be tough and pain is weakness leaving the body. There's all these like memes about pain and die off and things, but that's actually something that can be totally prevented. And oftentimes our protocols are designed to be so smooth that people don't even know they're on a protocol, meaning they're only getting symptom improvement. They're not having a worsening downhill slide before they then come back up. Generally speaking, we try to meet people where they are and just elevate.
110%. So first off, let's kind of just back up a little bit. So Candida is a type of fungus, right? Type of yeast. So like fungus is like the big umbrella, and kind of various molds from water damage kind of fits in the fungus kind of mold umbrella. Candida is a type of yeast, and Candida is the main kind of yeast that you see in the body. I mean, you could see the Microsporidia, the Rhodotorula, right? The Candida krusei, but Candida albicans is the major one we see. Now, how do we test that? We're going to test that in a stool test, like the GI map or a 401H stool test. Now, even the more genetic sensitive stool tests, they're going to miss Candida sometimes. So we're going to look at clinical symptoms, seborrheic dermatitis, that kind of crusty thing on the scalp. We're going to look for tinea versicolor, kind of a blotchy skin kind of rash. We're going to look at, jock itch. We're going to look at toenail fungus. We're going to look at thrush, that white coating in the mouth. So any of these clinical indications, there's more than likely going to be a systemic fungal issue. Again, once you get the fungus in the nails, that's kind of a localized infection, and you really need to hit that topically. So a lot of times you can hit that internally, but it may not be enough. You got to get there topically. So that's kind of how we're looking now. We may be doing an inorganic acid to look at diarabinitol to assess it, because the stool test may not be enough. And we look at the clinical indicators. We'll look at diarabinitol or diarabinitose on an organic acid marker. We may look at Candida antibodies, IgG, IgA, IgM on a blood test if there's systemic Candida issues. Those are kind of a couple of ways that how I'll look at it and assess it.
Yeah, you've got some other markers there too. You've got like carboxycitric acid, you've got tartaric acid. There's a bunch that are really similar to colonization of fungus.
Increase in oxalates too.
Yes, that's very true. Yeah, see, a lot of people, when they hear about oxalates, they think, oh my God, I just need to stop eating vegetables. No, you may just actually need to treat your Candida overgrowth.
Bingo.
We've seen that a lot. Well, I mean, I'm talking, we'll see oxalates at like a level of 400 on the oat, which is really, really high. And then the person is freaking out, and I'll say, just hang tight. Let's work on the Candida. And guess what? On the retest, oxalates always go back to normal. So that's a really, really cool thing that Justin and I have seen clinically, that your average person talking about nutrition, they don't have a clue about the connection there.
110%, Evan. Now, a couple things I want to highlight. How do we end up with a Candida infection? So we kind of talked about the testing and assessing, and I'll just tell you straight up, most conventional medical people, they're not going to really acknowledge Candida as being a big deal. I mean, the other issue would be like a yeast infection, like a vaginal yeast infection kind of thing. That'd be the other one. That's going to be typically it, right? A vaginal yeast infection is typically acknowledged, maybe an oral thrush issue, maybe a toenail issue. But for the most part, Candida as being a major problem in your health is very rarely going to be acknowledged by your mainstream medical practitioner. Most have go ahead.
And let me ask you what you mean by that. So you're saying if you go to the conventional doc and you're like, hey, I'm anxious, I'm depressed, I've got joint pain, I've got bad breath, I'm craving sweets all the time, I think it's Candida, they're probably going to blow you off. Is that what you're saying?
Yeah, unless you have like an isolated specific infection, or Candida tends to be a major, major issue in immunosuppressed people. So someone that has like HIV or AIDS, or someone who's a cancer patient who's been on chemotherapy and things that have kind of wreaked havoc on their immune system. That's where you see Candida, actually being lethal, where it could kill you, right? But those are in specific isolated situations. So I think most medical doctors are kind of like, it's beaten in their brain as, these Candida issues and fungal issues are only a problem in these kind of people, but it may be kind of a more subclinical stressor in someone who's not HIV positive or dealing with cancer. You could kind of be in a subclinical place. And then not to mention, birds of a feather flock together. So if you have a Candida infection, you may have an H. pylori infection or a H. pylori or a bacterial infection or a parasite infection along with it. So it could be multiple things at the same time. For sake of simplicity, we're going to just focus on the Candida piece in this podcast, though.
Yeah, let's just talk about a number, though, real quick, just for the curious mind listening to the podcast. I want to get your number. I'll tell you my number, which is, I would say 90 to 95% of people with Candida have some other infection at the same time.
Yeah, I agree. Yep. It's very rarely just Candida. I see a lot of people that think it's just Candida. But like you said, I think that's in the minority. I like the Pareto principle. So 80-20, so maybe 20% for me is just Candida. But right in that area, I think is pretty reasonable.
Yeah. All right. So let's get back to causes here. So drugs are like the biggest umbrella, but let's break some of those down.
So number one medication is going to be antibiotics, right? Antibiotics are going to knock down bacteria to a very, minuscule degree, but then you have what's called a rebound fungal overgrowth. And a lot more of the doctors are actually starting to get in tune with this. Well, they'll actually use specific probiotics and even Saccharomyces boulardii, which is a beneficial yeast that prevents Candida from overgrowing. So a lot more of the cutting edge medical doctors who understand the side effects of these drugs are recommending probiotics and specific beneficial yeast preventatively. That's number one. So it's going to have that rebound overgrowth. Ideally, number two is make sure you really actually need the antibiotics. A lot of times there's a natural alternative that you can go to that'll be just as effective and more safe. So there's that. And I'd say the next thing after that, I see it very frequently with women on birth control. Birth control pills tend to more have an alkalizing effect on the urinary tract and the vaginal canal. People think, oh, alkalinity is good. Well, not really, because probiotics, like the major probiotic that we know of is Lactobacillus acidophilus. What does that mean? Acidophilus literally means acid loving. So there's various acids that are produced by beneficial bacteria, and those acids make it harder for yeast to grow. So when you start to alkalize that urinary tract and vaginal canal, it actually makes it easier for yeast to grow, because the acids have natural antimicrobial effects. So when you decrease the natural antimicrobial environment, it's easier for critters and yeast to grow.
Well, it sounds like what you're saying is, in that case, then proton pump inhibitors, acid blocking medications would also further increase Candida, because now you're dropping down stomach acid.
Yes. And then here's kind of like another component, right? So we know birth control pills are going to typically drive up estrogen. They're definitely going to promote estrogen dominance. We know estrogen dominance is also going to do what to our gallbladder? It's going to make our bile more sludgy and not flow as well. And what does bile have? Bile has a natural antimicrobial effect as well, right? Various bile acids, right? So if we don't have enough bile, now we don't break down fat. And then the bile acids aren't in our digestive system to help provide an antimicrobial environment. So now it starts to allow SIBO to grow as well. So now bacteria starts to overgrow. So you can see how these things can really spiral out of control.
Yeah, we got a few more drugs to talk about, but then also I want to try to circle back to the gallbladder. Even just someone who doesn't, I guess I'll say it now just to get it over with, someone who doesn't have a gallbladder. We've done many podcasts on bile and increasing digestion and improving digestion, but it sounds like along this same vein here, someone without a gallbladder, they're going to be at a much higher risk of a Candida overgrowth.
Yep. And then if you're a female and you have estrogen dominance, right? And you know this because you start to have maybe excessive bleeding or a lot of symptoms leading up to your period, breast tenderness, mood issues, back pain, cramping, the whole 9 yards. That's a sign that you're moving in the direction of estrogen dominance. And then there's going to be potentially sludgy gallbladder bile flow, which then opens you up to more Candida issues on the backside. So it's like everything's kind of connected. So when people who are listening to this, if you're working with a good functional medicine doctor, you want to make sure they're going upstream and trying to connect all the different dots. Because if you're just seeing someone that's, oh, I'm just putting Candida in my crosshair and all I'm focused on Candida, and I'm not looking at the upstream effects, bile flow, HCl, foods, medications, other infections, you could really miss some really important barriers that would help with healing.
Yeah. So the goal is not run out the Whole Foods or wherever your doctor's office and grab your oregano oil and start popping it. That's not going to be the strategy here.
Exactly. So obviously, next thing we could talk about, we mentioned the medications, we mentioned birth control pills. I would just say refined sugar, refined carbohydrates are going to be a big one. I mean, some people are getting really nuanced and talking about ketones being a driving factor of Candida. I typically am not seeing that as being a driving factor of Candida. Acellular carbohydrates are much easier to process and much easier to fuel Candida in yeast. Is it possible ketones could, generally speaking, 99% of patients I see with Candida or yeast overgrowth, there's a history of a lot of refined processed carbohydrates leading up to it.
Yeah. There was several other drugs. I mean, we could go on and on about drugs. I'm sure we don't have any papers on it, but like the fluconazole, we talked about how that made Candida problems potentially worse. The funny thing is that's exactly what people are getting treated with. And so it's almost like the drug is making this problem worse. And now you have this phenomenon of the antifungal resistance that the Center for Disease Control's warning people about, which is the same thing we've seen with bacteria. So now you've got all these antifungal resistant strains running around. So I just want to hit on the drug piece just one more time and then stop talking about it, which is the fact that the very treatment you're getting is potentially making this worse. So if you keep going back on diflucan, nystatin, fluconazole, that could be part of the reason you're not getting better.
100%. And then also, we live in an environment where people are just more inflamed, right? So if you go to your conventional medical doctor with symptoms of inflammation, what are they going to typically prescribe? They're going to prescribe corticosteroid medications. Well, those corticosteroids, one, they're catabolic, they'll break down tissues, so they'll probably make your problem worse if used chronically. Acutely, it may be okay. But what do corticosteroids do to your blood sugar? They increase it. And then when your blood sugar, your blood glucose goes higher, what does that fuel more of? It fuels more candida. So being on corticosteroids chronically will actually increase your chance of more yeast issues as well.
Did you know the Center for Disease Control, they actually made what they call emerging infections program, and Candida is in that emerging infections program because they're saying that the Candida is becoming more virulent, it's creating more problems, they're seeing more resistance. So Candida, like you kind of mentioned, that it's really kind of ignored and maybe you'd get blown off if you brought that up. It's becoming more and more mainstream now because we're seeing the rise of it, and we're seeing so many more people in hospital settings. Like, for example, here it's talking about that each case of a candida infection in a hospital setting, it's estimated to result in an additional 3 to 13 days of hospitalization and an extra $6,000 to $29,000 in healthcare cost.
Makes sense. And then you throw C. diff on top of that, right? Because the longer you're in the hospital, your potential increase for C. diff goes up too.
Mm-hmm.
So it's like, yeah, there's a lot of potential vectors that can happen.
Not a good place to be. A hospital, someplace you might come in and never come out. So Candida could be one thing part of that. It's just not my favorite place.
100%. Now, there's a couple of issues that now spiral. Okay. I call these spiraling issues. So as soon as you start having candida issues, you may start having poor digestion. So you may start seeing more intestinal distress, and the infection now starts to create more stress, which is going to lower stomach acid and lower enzyme levels. Now that's going to make it way harder for you to extract nutrients from your B vitamins or your minerals, which are really important for mood and energy, right? So it's possible that also a lot of the candida and yeast may be eating up some of those nutrients. They may be consuming some of those nutrients. So you can see now you're starting to have a tug of war fight with the microbes in your body, and then the healthy digestion and the healthy absorption of nutrients as well.
Well, this is titled something about candida and mood issue connections. So let's get into that now. You mentioned this robbing. I think that's the perfect time to transition and talk about that. So you mentioned that you're getting your nutrients stolen basically by these microbes and fungi. So the mechanism there, at least the mechanism that comes to mind for me, is just that you don't have the amino acids to manufacture neurotransmitters. But what else is going on? Why else do you think the candida issues are contributing to mood issues?
Yeah, so you're going to have the competing of nutrients and amino acids and some of your minerals that are really important. Number two is you're going to have mycotoxins produced by the candida. Just like you have mold produce various mycotoxins like ochratoxin and such, you're going to have mycotoxins produced by the candida in your gut. And those mycotoxins can increase gut permeability. And the more gut permeability there is, the more that can stress out your immune system. And it can also allow undigested compounds and mycotoxins to cross the blood-brain barrier and hit the brain. And then as soon as things start crossing the blood-brain barrier, you're going to see an activation of your microglial cells, right? Your astrocytes are what make up the blood-brain barrier. Once these things go past the astrocytes, you're going to see an increase in the microglial activation. And that's going to now cause more cognitive issues because your immune system is now trying to fight a war against invaders entering the brain.
The problem is the immune system is suppressed because a specific mycotoxin that there's different species of fungi like aspergillus can create gliotoxin, but candida has been found. It was kind of this, it was a debate basically in the medical community. Does candida actually make gliotoxin? And it turns out it does. And gliotoxin is an immunosuppressive toxin. So you're talking about how you're trying to gain the upper hand, but you literally can't. That's how smart these things are, is that candida is suppressing your ability to overcome it by producing a toxin that damages the immune system. I mean, it's a very, very smart thing. Like if you're a fungus, the best thing you could do, kill somebody's immune system so they can't get rid of you. I mean, it's very, very smart.
100%. Now, I have one study here, one article here that's really interesting on Science Daily, where they're seeing a correlation or a connection between candida and people with schizophrenia. And obviously schizophrenia is going to be like the ultimate mood disorder where there's hallucinations and various, bipolar where you're manic and then depressive, you're on a high, you're on a low. But the fact that candida is associated with these kind of severe mental health mood issues isn't really important. So let me just kind of go through it. So in this study at the Shepherd Pratt Health System, they had 277 controls, and they took blood samples from a group of 808 people between 18 and 65. And I think 261 individuals with schizophrenia and 270 with bipolar disorder. And the researchers used blood samples of IgG Candida antibodies, which indicated a past infection. After accounting for factors like age, race, medication, they looked for patterns that suggested a link between the infection and mental illness. And it found no connection between the presence of Candida and mental illness overall. But when the investigators looked only at men, they found that 26% of those with schizophrenia had Candida compared to the 14% in the control group. So in men, it seemed to be a higher link. With women, it was about the same. So not as much with women, but very interesting. And also men with bipolar disorder had a clear increase in Candida as well, 26% versus 14 in the control. So that's really, really interesting.
Yeah, that's crazy. I've noticed a huge link where this is just clinically, right? I mean, the papers could say what they say, but what we've seen is a lot of people that have short fuses, they're irritable with their husband, they're snapping at their kids, they're saying, "Oh, I yelled at my kids. I shouldn't have. It wasn't that big of a deal." Time and time again, we notice when we address these type of issues, especially Candida, people will report, "Hey, I'm much more calmer. My husband likes me better. He says I'm more pleasant to be around. The kids are hanging out with me more." So this is huge. And let's mention one other toxin too. We talked about gliotoxin, but also with Candida, you've got acetaldehyde, which is very similar to an alcohol molecule.
Yep.
So you've got these people that report that they feel kind of drunk, or they may slur their words, or they may have issue with talking, like their tongue. It doesn't work. It's like they can't get the words out of their mouth. Sometimes that's just low blood sugar, right? If your blood sugar is real low, you start to slur a little bit. But if you have a Candida problem, that could also make you sick.
Yeah. And also, this is really important. So if you look at acetaldehyde and then you look at salsolinol is really interesting. So this is a compound that's made from acetaldehyde. Remember, acetaldehyde's made from, or Candida and yeast can make that. And they found that salsolinol has a negative impact on the substantia nigra, which is the part of the midbrain that produces dopamine. This is important. Why? Because dopamine is important for focus. It's part of the reward neurotransmitter. It helps you feel good when you make good decisions, right? You check your social media, you get a little like on Facebook or Instagram. Oh, little drip of dopamine, right? So it's part of that reward center. And acetaldehyde and salsolinol have a negative impact on that compound, that neurotransmitter being produced.
Wow, that is mind blowing. Okay, so now you got all these people just going on Instagram, and then they go to Twitter, and then they go to Facebook. All this dopamine seeking behavior. They may just have some Candida overgrowth. Maybe they've got other issues too. I mean, those apps are designed to be addicting, right? They've got like, brain scientists working at these companies to make these things addicting to pull you in. But you think of all the people, like if you go out to a restaurant, I know you see the same thing, and everybody listening sees the same thing. You go out to a restaurant, everybody's on their phones. It used to not be like that. Or you think about like a concert, like if you see an old concert video on YouTube, nobody's on their phones. They're just paying attention to the musicians. Now it's everybody's on their phone. It's like they just can't get enough. They can't get enough dopamine. So it's interesting to think that one of those underlying reasons would be Candida. Who would have thunk?
Yeah, I mean, there's one interesting study talking about, chronic candidiasis and a possible contributing factor to idiopathic Parkinson's. Now, the mechanism that I mentioned is the one through Candida, then producing acetaldehyde, and then producing salsolinol, and then salsolinol having that negative impact on the midbrain that produces dopamine. So it's important. I mean, are these things cut and dry and are guaranteed if you have Candida, you're going to have Parkinson's or have these type of neurological or mood issues? No, it's definitely not that way, but there could be a connection. And in functional medicine, it's very rare that this is causing 100% of your issues. It's normally there's a couple of maybe 4 or 5 or 6 things happening. Maybe 15% is contributed by this, maybe 20% over here, maybe 5% here. And then we just kind of do our best to do a really good audit and be able to figure out what the levers we need to move are and in what combination and what timing those should be moved. Does that make sense?
Yeah, it does. Here's the thing I always kind of debate about in my head. It's like, Are we just getting better at recognizing these type of health issues with people, or is it that these type of issues didn't exist? So, for example, Parkinson's. I mean, I don't know if we have any evidence on this, but before we were using before we created antibiotics, before we created glyphosate, which is killing the good bacteria and allowing Candida to thrive, before we had processed sugars, if you look at 100,000 year old specimen, a human specimen, were they having Candida overgrowth? Were they having Parkinson's? Were they having issues with dopamine? I mean, it seems like we've introduced so many new variables which have contributed to all these things. It's like we've done it to ourselves.
100%. Yeah. And there's a lot of different things. Like, for instance, on this little abstract I have here, they talk about like Parkinson's being an enigma. And they talk about oxidative stress being a factor, environmental toxins being a factor, genetic predisposition. Obviously, with autoimmune stuff, we know gut permeability is a big one. We know food, we know infections. So there's a lot of different variables. So when someone comes from like the conventional medical world into functional medicine, they're used to like, hey, I have a sore throat. Oh, I did a culture. It's strep, antibiotic, gone. Like it's like 100% the cause, 100% the effect, gone, variables isolated, right? And in functional medicine world with chronic health issues, there's a lot of different factors. And it's really hard to go from this isolated, cause and effect model where results are instantaneous to a model where there's a lot of different inputs affecting the output.
Yep. It's gotten a lot more complex. We wouldn't have had to have these conversations maybe 1,000 years ago, but now we've got a lot of new things that are damaging it. You've got the whole brain connection too, with like if you look up Candida and autism, for example, you'll find some papers on developmental and behavioral issues, probably just due to the same mechanisms, right? These toxins damaging the gut barrier, that intestinal permeability, allowing more toxins in, blood-brain barrier getting affected. So it all makes sense.
Yeah, I mean, I consider like conventional medicine for chronic health challenges is like checkers, and then functional medicine's like 3D chess because there's lots of different things that are happening. It's never just one,
Yeah.
Conventional medicine is the easiest when there's an acute issue because the cause is isolated. You don't need to know the cause when there's a car accident because the car accident is done. It's not happening every day. But when it comes to these chronic health issues, they are happening every day, and they're happening at a subclinical microscopic level where you can't even see it, right?
You
So
know
that's
what we
kind of where
didn't
we're at.
mention? I mean, it's so low hanging fruit. That's probably why we forgot to mention it, is alcohol, and how
Yep.
alcohol would be contributing to these issues in the gut, and not only damaging the gut barrier, making leaky gut worse, but also feeding and making Candida worse. Like we'll have people that clearly you're going to feel bad and dizzy and drunk if you're drunk, but you could have a small amount of alcohol, like a sip of a cider or a sip of a beer, and get symptoms from it. And that's likely because you've just added that onto the fire, and possibly that Candida is just flaring. I don't know if it's creating more toxin. I mean, what would you think when you have somebody that says, hey, I can drink a tiny bit of alcohol and I get very, very sick or drunk or symptomatic?
Yeah. So the kind of alcohol is going to be important because some alcohol is very, very low sugar to almost none. And some is much, much higher, right? Especially if you do one of these mixed drinks. So it really just depends. There's always going to be Candida present in your gut. So the idea that we're going to have Candida 100% gone is kind of a misnomer, but we're going to have it knocked down significantly where it's not a problem, right? And if you don't have all the other things lined up that we already mentioned with food and your immune and other infections under control and gut permeability and good bacteria, yeah, you may be more prone for a flare for something simple like alcohol. I mean, the goal should be we get you healthy enough where in the future, yeah, if you choose healthier sources, hopefully there won't be a problem, right? That's our big goal. But just to kind of piggyback on top of what other mechanisms of why you may have mood issues is the acetaldehyde from that alcohol or from the Candida is actually going to impair oxygen carrying capacity from your red blood cells. So you have less oxygen to your brain. What does that do? Less ability to regulate inflammation in the brain. And also alcohol or acetaldehyde, which is produced by the Candida, inherently causes a B1 deficiency. And you chronically see low levels of B1 in alcoholics, but you'll also see it with chronic Candida issues as well. And B1 is really important for brain and neurological health. And then if you have B1 issues, there's also a chance you could have B6. And B6 is really important for synthesizing your neurotransmitters, serotonin, dopamine, etc. So you can see how these things can spiral out of control pretty fast.
Well, there's a condition of the elevated cryptopyrroles, this issue of pyluria that many people talk about. You've got Walsh and some of these other guys talking about these major mood issues, like you mentioned, schizophrenia, bipolar. You've got anxiety problems, OCD problems. A lot of those are linked to issues with low B6, low magnesium, low zinc. So if you're getting robbed,
Hmm.
your gut's messed up, you may go after, like a lot of people will go and just treat pylorrhea. I've had practitioners, I won't mention the names, but people who go to these practitioners who
Yep.
specialize in like the Walsh and Pfeiffer protocols, where you're working on copper and zinc ratios and you're doing this B vitamin and that B vitamin, but they've never worked backwards. It's just, hey, take this B6, take this zinc, but they don't ask the question, why? Why did this issue happen in the first place? So here they are stuck on this long-term protocol and they have no clear next step. I always ask the question, well, what did they tell you? What was the next step or the next protocol? And they said there was none. It's just take the zinc, take the B6, and just enjoy your life.
Yeah, I mean, it's kind of going all in on one thing. And even if that one thing is there, other issues have to be present. The fact that that one thing is the driving factor and that there aren't other dietary or stressor issues is you're really going all in. I consider it to be like rearranging the deck chairs on a sinking ship. It's just
Mm-hmm.
okay, like I guess you're doing something, but it's not really fixing the underlying issue. So if we ever see, hey, is there a potential mood issue? Do we see markers on the organic acid test that show issues with B vitamins, especially B6? Like we'll look at xanthuronate or kinourinate. We're going to automatically supplement a foundational baseline of those nutrients just with general multi support. And if we see other markers, we could always just say, hey, let's try giving a little bit more zinc. Let's try giving a little bit more of these B vitamins and see what kind of effects we have. That's the easiest way to do it without having to go down kind of a rabbit hole, so to speak. And then also just in general, fixing the digestion, fixing the gut, you're going to be absorbing more of this stuff from your food anyway.
Well said. Coconut oil is pretty awesome. We found one paper here that was about using coconut oil to control overgrowth of fungal pathogens, aka Candida albicans. And this was just talking about, in comparison to the antifungal medications that coconut oil reduced. It wasn't just it wasn't just the candida itself. It's not that just the coconut oil kills the candida. No, it's actually reducing the colonies of it. So you can have this phenomenon that we'll see on the oat test where you've got colonization, meaning you may have yeast and mold hiding in a biofilm. And now you've got to address that. You can't just get the toxin out of this bucket. You've got a whole other bucket of biofilm where this stuff's living. And coconut oil was shown to reduce that colony. So very, very cool. I think using coconut oil as a supplement to help this, but also just in your daily life is wonderful.
Yeah, you could even use some of it, obviously just cooking your foods and such. And the main lauric acid that you get in coconut oil that's antimicrobial, guess what? It's in breast milk. So, you have moms that have kids with fungal or yeast issues, right? The breast milk's a really great natural solution, as well as, some good Saccharomyces boulardii as well.
Yeah, I'm sure there's a huge link. I don't have any papers pulled up right now, but I'm sure there's a huge link where you see infants or young children breastfed versus non-breastfed and candida overgrowth. I would say the kids that are breastfed probably have a less risk of candida overgrowth just based on that.
Yeah, and also what the mom has too. If the mom has goes too heavy on the carbohydrates and refined sugars, she could potentially, be passing that down as well.
Yeah.
Yep, absolutely. Well, anything else, Evan, you want to highlight today? I think we did a good job. I mean, I think if people are listening and they're trying to wrap their heads around it, number one, kind of make the foundational diet and digestive changes, follow my 6 R's, remove the bad food, replace the enzymes, acids, repair the hormones in the gut. And if you're having a hard time doing testing and assessing what's going on under the hood, feel free to reach out to Evan, evanbrand.com, or myself, justinhealth.com. There's book now buttons where you can schedule with us, and we see patients all over the world. But start with some of the foundational things. See how much that moves the needle. If you have chronic health challenges, I recommend do not just kind of throwing in some of the herbs, because sometimes say you could feel worse, especially if you don't set the foundation. And if you don't get a good window into what other microbes or infections could be present alongside.
Yep. Well said. No, I don't really have any other messages besides you can fix this. You can reverse this. You can get this thing under control. You already made the great point about the goal is not eliminate candida. We kind of painted it as somewhat of an assassin here, creating so many problems. It can be, but we're just trying to restore balance. It's all about balance. It's not the
Root cause.
eradication. It is the
Root cause.
balance. And that's the goal. And it is possible. So we love working on this issue. This is something that could change your life if you have this out of control. Here's the free test everyone can do right now. If you're in your car listening, make sure you're at a red light first. Don't wreck. Pull down your little mirror and stick your tongue out. Do you have white coating on your tongue? Do you see more white than pink? If the answer is yes, you may be onto something. So you may need to look deeper.
And then also one last thing is, if you're having chronic Candida issues and you're not able to knock it down, one, make sure you take a look at mycotoxins and mold in your environment, because it's possible that you're just getting exposed to a lot of mold toxins, and that could be really setting up Candida growing in your body from just the excess amount of mold, and that kind of depleting your immune response too. So make sure you get your house at least tested. We'll put some links below where you can get access to some of the mold testing kits. That's probably a good next step. Anything you want to say about that, Evan?
I know crap. Yeah. You're opening the can of worms on me here. So now I'm going to start part 2. We're going into another hour here. I would just say pets are also a really common source of Candida as well, meaning you let the dog out into the backyard, the dog picks up Candida spores, brings it into the bed. You let little Fido lay in your bed. We've seen countless people do the plate testing where they'll do what they call a tap test, where they'll go tap, tap, tap onto their bed or onto their carpet. And guess what? Tons of Candida comes up. So the source of the Candida may be actually from your house, from your pets, from your blankets, from your couches, from your cushions, from your carpets. And we'll actually see Candida show up on these plates, meaning that you could literally have your diet dialed in, you're on all the good supplements and all that, but we'll call it the mycobiome of your environment. You're breathing the stuff back in. It's then colonizing sinuses, colonizing the gut, and then boom, you've got Candida overgrowth. So this is why you really want somebody to help you, because you could go and think about yourself as just this little robot, and you've got this, you turn this knob and turn that knob and throw that supplement, but you forgot about you're part of a big ecosystem. So this is, maybe part 2, but that's the spark notes.
Yep. I think that's a good part too. All right. But yeah, if you have chronic health issues or chronic home issues with water leaks and mold and damage like that, definitely make sure you have that wrapped around. Take a look at my 2 podcasts where I interview Jeff Bookout and JW on this topic. That's going to be a great starting compendium for y'all. And if you guys are enjoying this content, thumbs up, give us a share. Let us know your experience with Candida in the notes below. And also, we appreciate a review on iTunes. justinhealth.com/iTunes, evanbrand.com/iTunes. We appreciate the review and getting the word out. You guys are helping people take control of their health by spreading the good word. Anything else, Evan?
No, that's it. You all take good care of yourself. We'll be in touch soon.
Have a good one. Bye.
Bye-bye.